So now let's look at what chronic inflammation really is. Let's understand this sneaky enemy. Chronic inflammation happens when acute inflammation to heal an injury or infection doesn't resolve. It burns up silently, progressing for months or years out of sight. Chronic inflammation is tied to serious diseases. Now, before we start looking at the serious diseases that have been attached to chronic inflammation, let me explain a little about inflammation. Inflammation is not a bad thing, actually. Now, I remember I had a very big cut in school when I was handling some glass pipettes in secondary school. It tore my flesh so much so that the first thing I saw was the flesh, not the blood. It was really deep. But as a how old was I? I was 16, 17. As a 16, 17-year-old, I didn't even bother to treat apart from the initial treatment they gave me in the school clinic of treating with iodine and spirit, which we used to use that time. Nothing else was done. I didn't go stitch it. I didn't I didn't do more than cleaning it with Dettol every morning. And the way it nicely sealed back. Anytime I want to understand how fearfully and wonderfully I made, I'll just bring up the arm, look at where the scar is, and just realize how nicely sealed it was without even the normal sutures that could have been done in the clinic. That was possible because of inflammation. So inflammation actually is a good thing. It's a mechanism God has put in our bodies to heal, to repair an injury or an infection. Now, when there's an infection, like let's say bacteria now, it's the inflammatory system, the immune system that will set up an inflammatory response in the body that will tackle that infection. They could raise up the temperature and the person could have a fever. That fever actually is a defense mechanism, an inflammation that makes the temperature of the body high and causes the bacteria to be uncomfortable in such an environment, renders the place unconducive for the bacteria to keep operating. And so the body has a way of now shutting down those things, as in silencing those invaders called infection. And even injuries that happen has a way of repairing, and that's inflammation. And so what happens in those cases is acute inflammation. The inflammation is so noticeable, it's very frank because it's trying to deal with something. So there should be, if somebody bumps his head on the wall, what will happen later on is that place becomes red, swollen, painful. All these are actually manifestations of inflammation because the tissue is trying to repair itself. However, if it continues, if that issue, the acute inflammation issue is not properly resolved, what happens is that the inflammatory response just keep going, 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 and it becomes like what? Slow poison to the body. Just burns the body, burns silently, progressing for months, years out of sight, and finally starts to progress to some serious diseases like diabetes, cancer, cardiovascular diseases like heart failure, neurological diseases like stroke, um which other one, neuropathy, peripheral neuropathy, autoimmune diseases like lupus, arthritis, pulmonary diseases. You now have people developing things that look like asthma. So if someone say, I've never had asthma before, how come I'm having it now? I've never been allergic to this particular thing. Now I'm having allergies. Could it be signs of chronic inflammation? Alzheimer's disease. These are some just an overview, a snapshot of what inflammation that persists for long, which we call chronic inflammation, what it can do.